welcome to Medical Dialogues Journal Club. I'm Mr. Zaman and today I'll be talking to you all about an original research article that is recently published in the Ibero-American Journal of Science, Measurement and Communication. Fracture research from India between 1989 to 2022, a scientometric study. We all are aware that fractures are considered a public health concern as they impose significant healthcare impact and health burden on an individual level, the public medical system, and the whole society. They also increase mortality and disability, and they are rapidly increasing in India in recent years. But till date, no bibliometric study has been performed on this subject. So coming to discuss about this study, we have with us today the lead author of the article, Dr. Professor Raju Vaishya, who is a renowned orthopedics and joint replacement surgeon having an experience of more than 35 years. He is currently a senior consultant at Indraprasth Apollo Hospital, New Delhi. His interest lies in knee and hip surgery, total joint replacement and arthroscopic surgery, regenerative therapy in orthopedics, arthroscopic shoulder surgery, arthritis and osteoporosis, and research and publications. We welcome you to Medical Dialogue, sir.
Thank you very much.
We know, sir, that fractures are usually the results of traumatic events like falls, road traffic accidents, and sports injuries. So what is the primary aim and objective of your study?
Our primary aim of the study was to find out the incidence of fracture in India and also to find out the type of publications that are being made from Indian authors in various journals, and what type of fractures are happening more common, and how can we allocate resources to deal with these fractures. We conducted this bibliometric study on the publications made by Indian authors related to fractures. As you know, trauma is increasing day by day, not only in India but across the world, more so in India due to poor road condition, rash driving, and people not following the traffic regulations so strictly. Despite an enormous load of fractures, the publications related to fractures originating from India are relatively not well known. That's why we conducted this study of the existing publication available in the literature between 1989 to 2022, that is a span of 34 years.
Alright, so what were the results achieved from the 1046 Indian fracture research publications that were identified?
There has been an annual average growth of publication of 23.95% in last 34 years, and most of these publications got an average citations per paper of 8.53%. 15% of our authors collaborated with international authors in their publication, and there were total 1046 papers published on fractures, out of which only 14 got citations of more than 50 so far, and these accounted for high cited paper, which are most valuable. And amongst these, maximum 2 papers were published by the authors from PGI Chandigarh, whereas 1 paper each, high cited papers, were published from AIIMS New Delhi, Maulana Azad, Indraprasth Apollo Hospital, Chipmar, Maulana, and KGMC.
Okay, sir. Since this is the first comprehensive bibliometric analysis of India's fracture research over 30 years, what conclusions would you like to emphasize on?
I would say that such studies are important not only for the researchers but also for healthcare managers or healthcare providers to plan strategies to prevent fractures, to treat fractures, to make resource allocation in the management of these injuries, and it may also help in developing national registry for fractures in future.
Thank you so much for your valuable insights, sir. Thank you for your time.
Thank you very much.
That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.